People to apply a traction splint, one person to handle the injured extremity, and the second to apply the splint. Start by removing the patient's clothing, including footwear, to expose the extremity. Cleanse any exposed bone and muscle of dirt and debris before applying traction. Apply sterile dressings to any open wounds and assess the neurovascular status of the extremity. When applicable, document that exposed bone fragments were reduced into the soft tissues. A photograph provides good documentary evidence and reduces the frequency of dressings being disturbed to inspect the wound. You can determine the length of the splint by measuring the patient's uninjured leg. The upper cushioned ring should be placed under the buttocks, adjacent to the ischial tuberosity. The distal end of the splint should extend beyond the ankle by approximately 6 inches or 15 centimeters. Position the straps on the splint to support the thigh and calf. Align the femur by manually applying traction through the ankle. Reassess the neurovascular status of the distal end of the injured extremity after applying traction. Position the ankle hitch around the patient's ankle and foot, while the other person maintains manual traction on the leg. The bottom strap should be slightly shorter than, or at least the same length as, the two upper crossing straps. Attach the ankle hitch to the traction hook, while the other person maintains manual traction and support. Apply traction in increments, using the windlass knob until the extremity appears stable, or until pain and muscle spasm are relieved. Again, assess the neurovascular status of the injured extremity. If perfusion of the extremity distal to the injury appears worse after applying traction, gradually release the traction. Secure the remaining straps. Frequently reevaluate and document the neurovascular status of the extremity after every manipulation.